In this lesson, we're going to talk about cultural awareness and what it means for you and your patients. As nurses, we need to understand what culture is and how it influences our patients. So culture is this idea of values, beliefs, or even feelings that people have. And they're often influenced by their customs, traditions, art, music, food. There's a lot that goes into culture. Let's talk about what culture includes and what it doesn't include. First off, it includes thoughts and communication that people within the same culture and what they have. It also includes things like actions, customs, and traditions. It also even is influenced by belief. So they're influenced by the history of the family of group. What culture does not include are things like race. It doesn't include ethnicity, and it doesn't include geographical roots. So where the patient's family may have lived like a long time ago. These things can influence beliefs or religion and customs and traditions, but they don't define them. And the reason you need to know the difference is so that you do not make assumptions about a patient strictly based on their race or ethnicity. Their race or ethnicity can maybe give you some insight into their family history, but that doesn't give you any sort of defining information about that patient's family or even their culture. It really involves some further investigation. What we're going to do is we're going to dive into what it means to be culturally aware and what it means for us when we're taking care of patients. The first thing that we're going to have to look at with cultural awareness is that we need to be sensitive to cultural values. If a patient wants to pray at a particular time, or if they have a special request, because it's important for them, maybe to their beliefs or their traditions or values, we don't necessarily have to understand it, but we do need to be sensitive. We need to be sensitive to those requests. We just need to try to cater to those patients and to those requests. The truth is we don't always understand and we don't always know everything about our patients, and we don't understand what they've been through or how important these values are to them. But it's important to maintain their autonomy as patients. And it's important to make sure that we're delivering the same high quality care, but being aware of those values at the same time. We also need to be able to, like I said, cater to their needs. If a patient has a request for maybe a dietary restriction, then be sure not to pass judgment, and we don't ask too many questions. And we want to go back to using the therapeutic communication. And the last thing you want to do is you don't want to come off as being judgmental, because it could be a sign of disrespect. We want to remember to build rapport, and we want to build those relationships, and we want to build those relationships with our patients and those families. And the last thing we want to do is hinder any sort of progress by coming off as judgmental. We also don't want to change their culture. We don't want to attempt to change their culture or beliefs. I know it can be especially frustrating if we're trying to deliver a particular aspect of care, but it's important to understand that the patient still has their rights. They have their rights to care. But what I want to do is encourage you to spend some time learning about the culture, become culturally competent. That means if you have a particular patient population, maybe in your particular area that you're unfamiliar with, and you're seeing a lot in your hospital, or you're seeing a lot of them in your clinic, or in your facility, I encourage you to do some research, ask questions among management. You can also talk to Chaplain. Chaplain is another great resource for it. And they can give you some insight into maybe how to best approach the patients who have questions. If you say, hey, I'm seeing a lot of, these people with this culture or these belief systems, and I want to know how to talk to them about that and also not be disrespectful. What can I do? Become culturally competent, educate yourself. Nursing is a lifelong career, or a lifelong learning career. So you want to make sure that you continue to build that education, that library in the back of your mind for yourself. And you want to make sure you continue to build a rapport with those patients. And there are definitely going to be times when you're going to have to be especially sensitive to cultural needs for maybe particular patient populations. And sometimes patients have special rituals, especially when it comes to things like end of life or postmortem care. Even pregnancy is another one, and delivery. And you need to do what you can to find out about those patients and what their needs are, and be sure not to pass judgment, and make sure you're not making any assumptions. You want to continue to give the same standards of care that you would give to anybody else. But if they ask you for a particular item that you can give them, do what you can to make them comfortable, especially for these types of situations. Another time that's really important is prayer time. If a patient has a particular dietary restriction, make sure that we're being sensitive to them and consider like we talked about prayer. I had a patient one time, and the patient's wife had her prayer mat, and she would put the prayer mat on the floor, and she would pray at a particular time of day. And I would just make sure that the doctors weren't coming in to make rounds. If I know the doctors were coming in, I would kind of peek in and just make sure that we weren't going to be disturbing anything for her. Because she still had, it was important to her because that allowed her to connect with her husband. And we wanted to make sure that we were being considerate of her. The other thing, be sensitive to their needs and values, right? We want to make sure that we're continuing to foster that nurse-patient relationship. And one thing I do want to mention, if you are asking your patient to do something that is against their culture, you're probably going to have a hard time with compliance. So just make sure that you're talking to all your providers, so you can set your patient up for success. That means you may have to pull in chaplain, or you got to pull some other resources to find out a way to make sure that your patient can stay compliant. Because like I said, if you're asking them to do something that's against their belief system or against their culture or their tradition, you're going to have a hard time with that compliance. So we want to try to find a way to meet that fine line. Today, we really focused on the human development aspect when we're talking about cultural awareness, and also talking about health promotions. You want to work on building those interpersonal relationships with your patient by being culturally sensitive. So let's recap. In order to understand how to be culturally sensitive, we have to understand what culture is. And culture, these are the customs, the beliefs, the values, the traditions for the patient. It helps them make them who they are. We also need to focus on cultural sensitivity. You need to spend time learning about the other cultures, especially the patient populations that may be prevalent around your hospitals or your facilities. Don't assume anything about culture. Remove any biases, remove assumptions. You don't want to have any preconceptions about a patient. And ask questions if you're curious, and how you can best care for your patients, depending on their needs and their cultural needs. Again, there are going to be some times where you're going to have to be particularly sensitive to tradition or to value for your patients. These events are really important for those patients and their family. So be aware sometimes some of these life events have significant value to the patient. Lastly, make sure that you're catering to your patient's needs, and your patients still have the right to refuse care. So be sure to do what you can to make sure that your patient stays compliant, as well as being sensitive to their values. That's it for this lesson. Make sure you check out all the resources attached. Now go out and be your best selves today. And as always, happy nursing.